Very warm welcome and wishing you a pleasant day from the program iMed. Ladies and gentlemen, we were discussing about many disciplines related to certain medical conditions. So today also we are going to discuss one of the most important conditions where you concern a lot. So we all love to be fair, we all love to be pleasant, and as a result we consider a lot about the skin. So today one of the dermatological, that means skin related condition, we are going to focus, and as per our guest Dr. Janaka Akaravita, consultant dermatologist of the National Hospital of Sri Lanka, we are going to discuss more important areas with regard to the common infections which we can encounter these days. Thank you very much, sir, for accepting our invitation and being here.
It's a pleasure.
Right. Okay. So when it comes to this subject, this is a wide area dealing with the skin, and today we are going to focus on leishmaniasis, hand, foot and mouth disease, and even tinea, a dermatological infection. So first of all, let's focus on leishmaniasis. What is that disease condition?
Yeah, actually, it is good to talk on these matters. Some of the things there are things which the people should know to identify or present to the clinicians initially. So leishmaniasis is something like that. Probably some of them know that a disease which spreads through sandfly. So sandfly is the vector, that is the insect which takes the parasite to our skin. So this is a vector-borne infection, parasitic infestation, which causes mainly the skin lesions.
Right.
So that's common in certain areas of the country.
Right. Okay, so when it comes to certain conditions, if for example we are boiling some water and some water is spilled onto our hand, it burns. Or sometimes if we are exposed to a certain chemical or something like that, we know, although symptoms doesn't arise at the same moment, we know that we came in contact with some of those irritant chemicals and those things. So when a sandflies comes and do these things for our skin or whatever it is, we don't know what actually has happened so far with regard to the history. But like certain symptoms might manifest. So what are the symptoms here?
Actually, now the sandflies are like outdoor creatures which stay outdoor, and so these bites occur mainly in the outdoor working people. So initially, a couple of decades back, we saw a lot of leishmaniasis patients in the army personnel. So the soldiers were waiting, in the sort of jungles or the outdoor areas. So that those days it was very common among the service personnel. But now the things have changed, and this parasite was not initially found in Sri Lanka about say 3 decades ago. So later on it was introduced. So it is widespread in the world. But later, about 3 decades back only, we started identifying them very frequently. So initially with the soldiers, then now with the farmers who work outside, and now it is a bit of much more common. So even anybody may present with these lesions. So as you said, now this sandfly bite may not be noticed by us. So when you work outdoor bare-bodied, so then you get the bite. So it may be just one of the bites we get when we work outdoor. But what happens is gradually there will be a tiny papule, a bump which occurs. It is not very symptomatic. It may be a little bit of pruritus, itching will be there. So this will gradually enlarge over a couple of weeks. So then later, maybe 1 month, 2 months later, this will become a little bit of a nodule, a larger bump, and at the center sometimes there may be a bit of ulceration, a wound-like thing. So this will progress. So it will become a larger lesion, and then gradually sometimes there will be a little bit of light color around the lesion. So this is commonly occurring over the exposed areas. So because of the bite, the excess of the sandfly. So this is the usual picture. So only when this is after about 3 months, 6 months, like the patient comes to us. So it is
Right.
better to identify it early.
Mhm.
I mean, it is better to prevent, and also early identification is good to prevent further
Right.
infection.
Okay. So when that type of a wound, like a small bump, then a wound like a certain blood clot or something like that resembles a wound, comes on the top of that bump and it progresses. So normally people, they don't consider it as a certain severe conditions, because like some people tend to like stay away from medications as much as possible, like with the expenditure, and they feel something like, oh, when I take this medicine there will be a huge number of side effects which I can control only by another medications. Likewise, they reason out many things and just keep away from those medications, and then that particular disease condition progress. And like apart from the wound, aren't there any specific conditions like fever or vomiting or something like common features that resembles and come together with this condition?
Yeah, as you explained, that's the very same reason I think why they present late. So generally about most of the patients come to us about 6 months late after the initial lesion.
Right.
So it is now leishmaniasis has a form called visceral leishmaniasis. So that is usually secondary to the skin lesions,
Right.
and sometimes it involves the mucosal surfaces. So the common form we see is cutaneous, so the skin lesions. So these skin lesions generally will not cause any systemic symptoms.
Right.
So maybe multiple lesions, sometimes may have many lesions all over the body, but that is I mean very rare. So the common form is the one which I described. There are certain little bit of different picture in some patients, but it is generally slowly progressing with minimal symptoms. So that is the usual story.
Right. Okay. So when it comes to that particular wound condition, we'll say it as a wound. So, but it is a different disease condition. What is the difference between the type of leishmaniasis appearance and the other ordinary wound that appears in the skin?
Yeah, that's very good. I mean, so just all the wounds are not leishmaniasis. So I think we should not make a panic situation. That,
Yes.
I mean, we get abrasions, cut injuries, all those things, a little bit of mosquito bites. So all those things generally will heal in about 1 week or 2 weeks. But this bump will slowly progress over weeks to months.
Right.
So that's one reason. When there is a bump which is slowly enlarging and with minimal symptoms, I think better to think at least 2 to 3 months time. If you notice that this is not going to go away, then better to see a clinician.
Right. Okay. So those types of conditions, if you are encountering with a wound slowly progressing, not getting cured, anyways, if it is leishmaniasis or not, it's better to consult a physician and get the advisors, because like, all right, there's a wound, it's slowly progressing, all right, it will cure by some couple of days and you are going to stay. Don't do that, because like you can't diagnose those things as certain disease conditions. And even like when it comes to a specific disease condition, sir, it's useless of studying like 5 to 10 years like in this particular field if people can diagnose themselves certain disease conditions. So you have to consult in a proper manner. And what I wanted to emphasize is that, sir, like it's slowly progressing and no other affiliated symptoms likewise in that condition, and it does not getting cured with the lapse of some time, and we can just conclude it as this type of a condition, and we should go for treatments. And sometimes people try to do some general applications. They try to purchase some of the ointments, creams, and certain cleaning mechanisms. Cleaning is anyways good for a wound, as I wish, but like doing certain applications on wound. If it is an ordinary wound like an abrasion, which is like certain stitches or something like that, certain cut injury, it will be getting cured with a certain condition. But this has a lump like thing, a wound, like people tend to do some applications superficially, and they even try to drink some internal medications prescribed for certain other wound conditions. Will it worsen?
Yes, it can worsen, and that is something which you should not do. So I mean, using an antibiotic on a cut wound, that is you can do. I mean, anybody can do. There's no harm. But experimenting with other various herbal medications and certain other sort of home remedies is not good for anything. And especially if you are taking something oral, better to get a medical advice. I mean, easily you can meet to a family doctor and get an advice. So I mean, when we get a cut injury, it's okay, you can clean with soap and then apply an antibiotic ointment. But if you are going beyond that level, I think better to meet your family doctor and get an advice.
Right. Okay. So you got a certain understanding about leishmaniasis, which is a common condition. Might be like you are exposed to a certain sandfly condition, and you might develop that type of a condition. So as per our doctor's request, we are going to give you some more information, inside information, and understanding about some other disease conditions as well. So this is some outline about this condition, and we are going to move to the next: hand, foot, and mouth disease. So what is that disease, sir?
Yeah. Now we have parasites attacking us, bacteria, fungi, and this is a virus disease. Hand, foot, and mouth disease is a virus disease coming under Coxsackie viruses. So it is spread by the respiratory route or by contact, and it causes certain systemic manifestations as well as skin lesions. So it's a viral infection which is now common. So we get certain time to time epidemics with hand, foot, and mouth disease. So over the last years, there are certain times we see a lot of patients. So these days we have noticed that so many patients are coming with this hand, foot, and mouth disease. We know we were sort of without having any social contacts during last 2020-21, but now people are moving around, so these other viruses have started to spread as well.
Right. So what type of a wound is it? Like a redness of the skin? How does it appear, sir?
Yeah. Now this name itself gives a clue: hand, foot, and mouth disease. Now this virus it enters to the system and causes some systemic symptoms like fever, bit of myalgia, and it also invades our GI tract, that is the bowel. So there may be a little bit of loose motion, fever, bit of cough, myalgia. So these are not very severe. This is not a very severely disabling condition. So same time, this fever will last for about 2 to 3 days, and the other symptoms also maybe a couple of days. And same time they will develop little bit of red patches on the hands, feet, and the oral cavity or the mouth. So so they start as a red patch. Then this red patch may be a little bit of painful, sometimes a little bit of burning sensation, sometimes maybe itchy. So it gradually becomes easily palpable and then become a vesicle. So this vesicle will have a bit of a grayish color fluid appearance, and the surrounding area will be bit of red color. So we get a sort of central grayish color tiny vesicle of 2 to 3 millimeters with a bit of a red halo around that over the hands, feet, and mouth. But the other areas also can get involved. Sometimes we see around the knees, sometimes the buttocks, so those areas. So these vesicles will stay there for about 3 to 4 days and gradually dry up, form a scab, and clear.
Right. So, like sir, you mentioned the name of the disease: hand, foot, and mouth, and those types of appearances, emerging things can be seen on those parts of the body and some other parts as well. So it is confined to a single area: hand or foot or mouth, hand and foot and mouth, or what is that relationship?
Yeah, that's I mean, for the easiness probably this name is given, but those are the 3 common areas. Commonly all 3 areas.
That means only in the mouth there can be?
There can be, I mean rarely there can be, and also maybe widespread. And the other thing is this is more common in children, less than around 5 years, so schooling children, but still adults also can get this disease.
So what are the triggering factors for such type of a condition, sir?
This is an infection.
Right.
So it is, I mean, like common cold you get when you associate with the person infected.
Right.
So initially, even without symptoms, sometimes the person who has the virus may be spreading.
Right.
So then when they are febrile and when they have the lesions, they are more infectious. Gradually when the fever settles and the lesions dry up, they become non-infectious. So the other person who gets the virus may stay without symptoms for about 6 days, 6-7 days, and then only they will develop the manifestation.
Right. So when your explanations were going on, so I heard like the people might notice that part very well. So this develops and gradually forms a scab and moves out. That is the end of this disease.
Yes. So the infection is over, but still now when these scabs fall off, they may remain the scar, like
Right.
the scale in desquamation may remain for a couple of weeks, and we have noticed that they get a bit of changes in the nails. So sometimes it appears about a couple of weeks later. So there are some parents come got bit of panic seeing that their child's nails are going to fall off. So that is an after effect of this
Right.
virus. So that is another thing I think the listeners should be aware of. You don't have to worry about it. There will be a new nail coming behind that. So that is a common sequel we see.
Right. And so like they might have noticed certain factors, like when I was asking the triggering factors, this is an infection, so certain, if we are prone to certain infectious agent, might be a certain person who is infected, we can get that disease, and even like without giving much of a disturbance they will move out. So no use of meeting a doctor for these types of conditions, like the appearance also we know, hand, foot and mouth, no use of going for a doctor, like this will get finished by a couple of sometimes 1 to 2 weeks or whatever it is. They might neglect these types of conditions. So what is the importance of having medications for such a condition?
Yeah, now as we know, there are only few viruses which you can treat with specific medication. So here again we don't have a specific medication for hand, foot and mouth disease, but still rest is an important treatment. I mean, it's a therapy,
Right.
which we should follow when there is a viral infection. So especially schooling children should not be sent to the school, not sent for playing, etc. And then the hydration, they should take a lot of fluids and balanced diet. If they don't have fever, I mean, it's okay to have a bath and keep these wounds clean. You should avoid getting secondary bacterial infection, as well as sometimes we replace them with vitamin syrups containing zinc as a measure to prevent this nail loss which may occur later. Rarely, very rarely, there may be certain bit of a serious sequelae, but that is not very common. I mean, having bit of involvement of the meninges, the brain, those are very, very rarely reported. But if you take measures to rest and supportive care, and until you recover, then you are safe.
Right. Okay. So we got to know about two disease conditions: hand, foot, and mouth disease and leishmaniasis. And now we are going to concentrate on another dermatocyte infection, which is tinea related. Can you just explain that as well, sir?
Yeah. So this is a fungal infection. So I think it is important to talk on that as well, because it's widely spreading. So dermatophyte epidemic or tinea epidemic. So this is seen in our country as well as the other countries in the region like India, Bangladesh, Pakistan, Nepal, etc. So tinea had been there all throughout. That's a common, sometimes people say joke itch. So that's like that itself describes that it occurs over the moist areas,
Right.
the groins. So this is a fungal infection which causes tinea. Actually, it's like a ringworm. That is the other name given to it. So when this fungus spreads, it looks like a ring lesion.
All right.
So the spreading area is very active, having tiny papules, bumps and pustules, scales, central clearing. So that is why it is called ringworm. But lately we have seen over the last maybe 5-6 years, this tinea is not usually responding to our former simple treatment, so we may have to go for newer antifungals, and sometimes we have to go for higher doses, and we may have to give the treatment for a longer period. And also the patients come with many lesions. Earlier days we saw only 1 or 2 lesions, but now they come with a lot of patches all over the body. So that is the trend, and so better to go for early treatment and be aware about this. That is good.
Right. So if it is left untreated, what are the consequences?
Actually, now tinea infection, if untreated, that will be sort of, troubling the patient, itching and the symptoms, and sometimes it may be a cosmetic issue as well when it occurs over the face, and that will propagate the spread of the disease to the others, and there may be secondary infections as well because it is itchy. So then secondary bacterial infections. So those are the problems if we stay untreated. Generally it may not resolve without treatment, so you will be having the infection all throughout.
Right. Okay. So when it comes to those particular explanations, there were a word recurrently occurring, secondary infection. So this is like some sort of an initial thing. Then likewise, if it is not being treated or with this disease, second step might be followed. So what are the things that we can conclude in that context of secondary infections?
Yeah, actually now, so when you don't treat the condition, number one thing is that will keep on spreading in your body. So then you will be spreading to the others. So then the family members will get involved, then the workmates may get involved. So those are the major issues. And now then you may get secondary bacterial infection on top of the fungal infection as well.
Right. So we discussed about the 3 disease conditions: leishmaniasis, hand, foot and mouth disease, and tinea, a dermatocyte infection. So when it comes to a common ground, these diseases might be like frequent in this type of a context, and as a consultant, when you are just advising patients and you are meeting patients in clinics, these conditions might be a more common a condition. So but can you conclude what the reason behind this is to these conditions to be more common?
Actually, regarding the tinea especially, so the probably sharing clothes is one reason, and the misuse of steroids. We know there is a drug group, steroids, which suppress our immunity.
Right.
So it is used for contact dermatitis, etc., the dermatitis condition. Sometimes people use it for whatever the rash they get. So they start applying. The thing is, they improve initially because the body's reaction is suppressed, but the fungus spreads. So don't misuse the medications. Don't share the same clothes. The cleanliness, personal hygiene, wearing same clothes for long hours, etc. Those should be avoided. That is for the tinea and early treatment. Then of course for the virus diseases, that's usually it settles on these epidemics settles on its own. So when you are infected, better to avoid spreading to the others. Leishmania, of course, we have to cover ourselves when we go out, take measures to apply insect repellent, something like citronella oil at least when you are working outdoor. So, and if you get the lesion, better to go for medical treatment at the initial stage.
Right. So it's the skin, it's your appearance. At the end of the day, it will cause another condition which will make you in a severe discomfort more. So ladies and gentlemen, we're discussing about certain skin infections, the leishmaniasis, hand, foot and mouth disease, and tinea, a dermatocyte infection. So thank you very much, sir, Dr. Janaka Akaravita, consultant dermatologist of National Hospital of Sri Lanka, for doing the honors with regard to these disease conditions. And we learned a lot, the conditions that they are prevailing, how to do a proper identify, as in you're not going to give treatments for your own conditions, but to have the proper time that when to meet a physician, and certain conditions that you can manage at home depending on the condition. So hygiene, misuse of medications, you might have heard that in the latter part of the program. So concentrate on those and concentrate on your health, so you will be having a good well-being. Physical hygiene and misuse of medications, just concentrate those two from today's program. That would be ideal for you all to maintain a good well-being. So thank you very much, ladies and gentlemen, for watching iMed. Stay tuned with more interesting topics in the future. Thank you very much. Have a pleasant day.
That so there are